Everyone, today we are going to learn about hospital acquired infection. Myself Vinoli, lecturer from Triple M College of Nursing. Let's get on to the video. Let's see the objectives of the topic. At the end of the class, students will be able to understand about introductions about the hospital acquired infection, definition, epidemiological interaction, microorganisms cause of nosocomial infections and types of infection, mode of transmission and chain of infection, goals for infection control and hospital epidemiology, prevention and control of nosocomial infection, source of infections in the hospital, infection control committee structure and role, universal standard precautions for infection control, and coming to the conclusion. Now let's understand introduction about hospital acquired infection. Hospital acquired infection is also called nosocomial infection or healthcare associated infections. Nosos means disease, commune means to take care of nosocomial infections. Here can be defined as the infections acquired by the persons in the hospital, manifestations of which may occur during the hospitalization or after the discharge from hospital. The persons may be a patient, member of the hospital staffs, or visitors. These hospital acquired infections or infections acquired during the hospital care which are not present or incubating at admission. Infections occurring more than 48 hours after admissions are usually considered nosocomial. Definition: an infection is acquired in hospital by the patient who was admitted for a reason other than that infection. The infections occurring in a patient in hospital or other healthcare facility in whom the infection was not present or incubating at the time of admission. This includes infections acquired in the hospital but appearing after the discharge and also occupational infections among staffs of the facility. Epidemiological interactions about hospital acquired infection. It has three factors: agent factors, host factor, environment factors. Agent factors: varieties of organisms, institutionals, and human reservoirs and their virulence. Host factors: suppressed immune systems due to age, poor nutritional status, severity of underlying disease, complicated diagnostic and therapeutic procedure. The environment factor: everything that surrounds the patients in the hospital environment, other patients, hospital staffs, and visitors, dust, and other contaminated articles. See, what are the microorganisms causing the nosocomial infections? Like viruses, bacteria, fungi, parasites. For examples, gram positive and gram negative. Gram positive is Staphylococcus aureus and Staphylococcus epidermis. Gram negative, Enterobacteriosa and Pseudomonas aeruginosa and Acinetobacter baumannii and Mycobacterium tuberculosis. For viruses, for example, bloodborne infections like hepatitis B virus, hepatitis C virus, and HIV virus, human immunovirus, and other viruses like rubella, varicella, and SARS. Some fungus also one of the cause like Candida, Aspergillus. What are the types of hospital acquired infections happen? For example, CLABSI, central associated bloodstream infections, and CAUTI, catheter associated urinary tract infections, and SSI, surgical site infections, and HAP, hospital acquired pneumonia, VAP, ventilator associated pneumonia, and colostrum difficult infections, and gastrointestinal infections. And what are the modes of transmission of these hospital acquired infections? For example, contact with the hand, bone, and most common, and aerial route or airborne is most common, and oral routes, parenteral routes, and vector-borne routes. For examples, direct and physical contact like hands and clothing, droplet, and contact followed by autonoculation and clinical equipments, and indirect via contaminated articles like bedpans, bowls, jugs, instruments like needles, dressings, and contaminated gloves and etc. articles. Airborne transmission, droplet respiratory secretions on surfaces, inhalations of infectious particles, examples TB and varicella, oral route, parenteral route, and vector-borne one. Through the mosquitoes and flies and rats is also can the cause of the mode of transmission. Chain of infection. To control the nosocomial infections, we need to consider the chain of infections and the transmission of an infectious agent. So, here there are the 6 elements in the cycle of infections. All 6 must be present before the transmission of infections can take place. What are the goals for infection control and hospital epidemiology? There are 3 principal goals for hospital infection control and prevention of the programs. The first one is to protect the patient, and second, protect the healthcare workers and visitors, and other in the healthcare environment. And third, accomplish the previous 2 goals in the cost effective and cost efficient manner and whenever possible. Healthcare workers, how to prevention and controlling of the nosocomial infection. So first thing is observance of the aseptic technique to be used, frequent hand washing especially between the patients, and careful handling and cleaning and disinfections of the formalities can be used, and where possible use of single use disposable items can be used, and patient should be in isolation, and avoidance where possible of medical procedures that can lead with high probability to nosocomial infections, for example urinary catheter or other medical procedures, and various institutional methods such as air filtrations within the hospital and appropriate isolation precautions to protect the patient, visitors and hospital healthcare workers. Then surveillance for the common infections like monitoring the high risk patients and hospital area to identify the outbreaks and document the incidence and prevalence rate of specific infections and set of goal for the improvement. How come patients are getting hospital acquired infections? First, the patients with the infectious disease are frequently admitted to hospital. Some of these patients are able to spread their organisms to other patients and they provide the one source of infections in hospital patients admitted for other causes. The commonest forms of hospital acquired infections are due to invasive procedures carried out on the patients, such as surgical operations, intravenous therapy, intubation, catheterization, and some immunodeficiency of varying degrees. It seems many of the patients admitted to the hospital. This includes the patients at the extremes of age, patients with diabetes and receiving the immunosuppressive drugs, and patients with cancer, in particular those undergoing the chemotherapy treatment. So these patients are prone to infections with bacteria which have little threat for healthy person. What are the sources of infections in the hospital? There are 2 types of sources, endogenous sources and exogenous sources. Endogenous sources, which means a direct one. Here the transmission to site outside natural habit. Examples urinary tract, wound, damage to skin. Inappropriate antibiotic therapy allowing over the growth. So source is the normal intestinal flora or colonizings of the skin and other epithelial surfaces from other patients or members of staffs, and microorganisms are transmitted between the patients. An exogenous source of infection, which means indirect one. So here caused by the organisms occurring by exposure to hospital personnel and medical devices or hospital environment, cross infection from medical personnel. And other patients cross infections and healthcare workers and inanimate objects, form it is vehicles and inanimate environment of the hospital. For examples, contaminated air, water, food, and contaminated equipment and instruments, and soiled linen, IV fluids and catheters, hospital waste, biomedical waste things. So we need infection control committee in the hospital. So the hospital ICC infection control committee is charged with the responsibility for the planning, evaluation of evidence-based practice and implementation, and prioritizations and resources allocation of all the matters relating to infection control. We need infection control committee members. So we have a structure of infection control committee. So first one is chairperson, head of the institute preferably, and members of secretary, senior microbiologist, and members of representations from the management and administration, dean, director of hospital, nursing services, medical services, and operations, and relevant medical faculties and support services like OT, CSST, housekeeping, sanitation, engineering, pharmacologist, store officer, and materials department, and final most one infection control nurse and infection control officer. Then role of the infection control team. The first, education and training, development and disseminations of infection control policy, monitoring and audit of the hygiene and clinical audits to be maintained, and the infection control program is responsible for oversights and coordinations of all infection control activities to ensure an effective program, and organizing an epidemiological surveillance program for nosocomial infections, and participating with the pharmacy in developing a program supervising the use of anti-infective drugs and ensuring the patient's care practices, patient risk, and checking the efficacy of the methods of disinfections and sterilization, and the efficacy of the systems and developed to improve the hospital cleanliness, participating in development and provisions of teaching program for the medical, nursing, and allied health professional, and as well as the categories of the staff members, providing the expert advice, analysis, and leadership assistance for the smaller institutions. Role of the physicians in the hospital acquired infection. The physicians have unique responsibilities for the prevention and control of hospital infection. For example, by providing the direct patient care using practices which minimize the infection, by following the appropriate practice of hygiene, for example, hand washing and isolation technique, and protecting their own patients from other infected patients and from the hospital staffs who may be infected one, and complying with the practices approved by the infection control committee, obtaining the appropriate microbiological specimens when an infection is present or suspected, notifying the cases of hospital acquired infections to the team as well as the admission of infected patients. Role of the hospital pharmacist. The hospital pharmacist is responsible for obtaining, storing, and distributing the pharmaceutical preparations using practices which limit transmission of infectious agents to patients, and maintaining the records of antibiotic distributed to the medical department, and providing the antimicrobial use committee and infection control committee with the summary reports and trends of antimicrobial use, then providing summary reports of prevalence of resistance monitoring, sterilization, disinfection, and environment where the necessary. Participations in development of guidelines for antiseptic, disinfectant, and product use. Role of the nursing staffs. Implementation of the patient's care practices for infection control is the role of the nursing staffs. The senior nursing administrator is responsible for participating in the infection control committee and promoting the development and improvement of nursing techniques and ongoing review of aseptic nursing policies with approval by the infection control committee. Role of the food services. The in charge of the food services must be knowledgeable in food safety, staff training, storage and preparation of foodstuffs, job analysis and use of equipment. The head of category in services is responsible for defining the criteria of the purchase of the foodstuffs, equipment usages, and cleaning the procedures to maintain a high level of the food safety. Role of the laundry service. The laundry is responsible for developing policies for working clothes in each area and group of staffs and maintaining the appropriate supplies, ensuring that liquid soap and paper towel dispenses or replenished regularly, and distributions of working or clothes, and if necessary managing the changing rooms, developing policies for the collection and transport dirty linen, and defining where necessary method of disinfections and infected linens, and either before it is taken the laundry and into the laundry itself. Role of the housekeeping services. The housekeeping service is responsible for the regular and routine cleaning of all surfaces and maintaining the high level of hygiene in the facility. So first they should classifying the different hospitals areas by varying need for cleaning and developing policies for appropriate cleaning technique like procedure, frequency, agent used, and etc. for each type of rooms and from highly contaminated to the most clean one, and developing the policies for collection, transport, and disposable different types of waste, for examples containers and frequency also, and ensuring that liquid soaps and paper towel dispensers are replacing regularly, and informing the maintenance services for any building problems requiring repairment. What are the universal standard precautions for infection control? First one is hand hygiene, personal protective equipment, safe handling and disposable of shops. Follow the needle stick injury protocol and safe handling and disposable of waste, managing the blood and bloody fluids, and disinfections and equipment, environmental disinfection and immunization. The first precaution is hand hygiene. The hands are the main source of transmission of infection during the healthcare system. Hand hygiene is therefore the most important measure to avoid the transmission of harmful microbes and prevent healthcare associated infection. The hand hygiene techniques are alcohol hand rub, routine hand wash 10 to 15 seconds, aseptic procedures 1 minute, surgical wash 3 to 5 minutes. The first hand hygiene technique is hand rub. Alcohol based 70 to 80 percentages of ethyl alcohol and chlorhexidine 2 to 4 percentage based hand rubs are available. Duration is 20 to 30 seconds, can do the hand rubs, and advantages for after the period of contact it gets evaporated off it is own, hence drying of hands is not required in separately. Indications of hand rub indicated during routine rounds in the wards of or ICU setups and in all the moments or situations requiring hand hygiene, and except when the hands are visibly dirty or soiled, when it will be an infective one, can do the hand rub. The second hand hygiene technique is hand wash. Antimicrobial soaps like liquid, gel, or bars are available, so can be used for the hand wash. And if facilities are not available, then even ordinary soap and water can also be used. Duration for the hand wash of 40 to 60 seconds. An indication when the hands are visibly soiled with the blood and exterior pus or etc. And then before and after the eating and after going to toilet and before and after shift of the duty can do the hand wash. Steps of hand rubbing and hand washing under the World Health Organization. The step 1 is apply the hand rub or wet your hands and apply the hand wash. Step 2 is palm to palm. Step 3 is back to palm, both sides. Step 4 is interlaces in between the web space. And Step 5 is back of the finger on palms, both the sides. Step 6 is thumb rotational rubbing, both sides. Step 7 is scrub your nails on palms, both sides. Step 8 is rinse hands with water. Step 9 is dry with a single use paper towel. Step 10 is close the tab with the same paper towel or elbow if there is elbow handle is present. Steps of hand rubbing and hand washing under the World Health Organization. The step 1 is apply the hand rub or wet your hands and apply the hand wash. Step 2 is palm to palm. Step 3 is back to palm, both sides. Step 4 is interlaces in between the web space. And step 5 is back of the finger on palms, both the sides. Step 6 is thumb rotational rubbing, both sides. Step 7 is scrub your nails on palms, both sides. Step 8 is rinse hands with water. Step 9 is dry with a single use paper towel. Step 10 is close the tab with the same paper towel or elbow if there is elbow handle is present. What are the 5 movements of hand hygiene? The first one is before touching the patient. The second movement before cleaning and aseptic procedure. Third movement after body fluid exposure risk. Fourth movement after touching the patient. Fifth movement after touching patient's surroundings. Personal protective equipment. Used to protect the skin and mucous membranes of hospital acquired infection from exposure to blood and bodily fluids. From the hands to the patients during the sterile and invasive procedure. So we need to must be used whenever high risk patient is being handled. To be used gloves, disposable plastic apron, mask and eye protection. There is 2 types of gloves are available. Non-sterile gloves, sterile gloves. If you use the non-sterile gloves, use when there is a risk of infections to hospital infection. For example, while touching the blood, body fluids, secretions and excretion of patients, items, equipments or environment. The gloves using the sterile one used when there is a risk of infections to hospital acquired infections as well as to the patient during surgeries and invasive procedure. The plastic apron is used during the surgeries. Gown used during the surgeries and when soiling is likely to be expected. Surgical mask used during surgeries and while handling the patients on droplet precautions. An N95 mask is used while handling the patients on airborne precautions like for example tuberculosis. And cap and face shield goggles and used when the spillage of blood is suspected. Examples during the major cardiac surgeries or etc. And surgical shoes is used mainly in ICUs and operation theatre to protect the hospital acquired infections and environment from the transmission of organism. The third precaution is safe handling and disposal of shops. The main hazards of shops injuries are hepatitis B, hepatitis C, HIV, and ensures that the shops are not passed from hand to hand. Needles are not broken or bent before use. Shops are disposed of at point of use. Shops container are not filled more than 2 or 3rd. Staffs are aware of inoculation injury policy. Follow the needle stick injury protocols. So if you get the needle stick injury, immediately irrigate the mucous membranes by washing under running water. Do not suck, squeeze the injury site and wash with soap and water. Apply the antiseptic lotion to the injury site and contact emergency room medical officer for management and complete the incident report and inform to the ICN, infection control nurse. Safe handling and disposal of the waste. So first segregate the waste at sources and know the policies and protocols of the state, and safe disposable to be done. Safe handling of the spillages. Then how to managing the blood and bodily fluids. Handle specimens safely, like collection, labeling, transfer, dealing with the spillage and small spill, spotted spill, large spill, so to be managed. How to managing the blood and bodily fluids of the small pills. So first, wear the gloves and eye protection. Then contamination should be wiped up with a paper towel soaked in freshly prepared hypochlorite solution 1%. If broken glasses are present, first treat the spillage with the hypochlorite, then carefully remove the glass piece with the disposable forceps and wipe it up. Then towel and glasses should be disposed of the yellow clinical waste bag for the incineration. And finally, wash your hands. Then how to managing blood and bodily fluids for the large spill. First mark that area as a large spill. Then wear the PPE, personal protective equipments like a gloves, mask, cap and eyeglass or apron. Then liquid spill should be covered up with a hypochlorite solution and left for 2 minutes, and use the absorbent or absorbed cloths one, and wipe it with the water and detergent that area, and allow that to dry the areas, and then put all the towels, gloves to yellow bin for incineration. Infection control checklist. Have you washed your hands? Do you need to use personal protective equipment? Are you preventing a sharp injuries? Are you disposing of waste safely? Are you deal promptly with the spillages? Do you thoroughly decontaminating equipment? Are you maintaining a clean environment? Do you know what to do in the event of accident? Do you know your workplace procedures? So these are the universal precautions of the infection control in the hospital. I hope this video will be useful for everyone, and I hope hereafter will be reducing the hospital acquired infections in the hospital setup. Thanks for watching. I hope this video will be useful for everyone, and I hope hereafter will be reducing the hospital acquired infections in the hospital setup. Thanks for watching.